Hi, I'm Dr. Thomas Gerber, one of the associate editors of Mayo Clinic Proceedings. I'm also a professor of medicine and radiology at the Mayo Clinic College of Medicine. How do you like our new setup? All new lighting, and I get to look straight at you now. But of course you would rather hear about the editor's choice and the highlights in the December 2014 issue of Mayo Clinic Proceedings, right? Well, okay then. Our editor's choice this month is the concise review What Clinicians Should Know About the 2014 Ebola Outbreak. It was written by Drs. Tosh and Sampath Kumar from Mayo Clinic here in Rochester. They provide an excellent overview of the virology, clinical course, treatment and infection control. There's also supplementary material that you will find really helpful for your practice and for patient discussions. That material includes a screening algorithm for patients who have traveled to affected countries or had contact with a known case and now present with fever. There's also a personal protective equipment checklist for those of you who might at some point care for known or suspected Ebola patients. Like most of our concise reviews, this one too comes with CME credit if you complete the appropriate documentation. One of the highlights in this month's issue is an invited commentary that goes with the concise review on the 2014 Ebola outbreak that we just discussed. This commentary, Ebola virus, Inadequacies of Public Health in Liberia, was written by Dr. Yvonne Butler, a gynecologist from Mayo Clinic here in Rochester, who has 2 years of first-hand experience of practicing in Liberia until just a few months ago, and who personally witnessed the initial stages of the current Ebola outbreak. Another highlight in the December 2014 issue of Mayo Clinic Proceedings is an original article on pharmacotherapeutic failure in over 1,200 patients who presented to a community-based sleep medicine center with insomnia. In their retrospective records review, Dr. Barry Krakow and colleagues from the Sleep and Human Health Center in Albuquerque, New Mexico, found that many of these patients had moderate to severe sleep-associated breathing disorder on polysomnography. The important message of this article for the primary care community is that commonly used primary care screening surveys for sleep-disordered breathing had false negative results in more than 30% of these patients. And I would be remiss if I didn't mention the editorial on this article that was written by our editor-in-chief, Dr. William Lanier, who is a neuroanesthesiologist by trade. He and Dr. Kanan Ramar, a sleep medicine specialist from Mayo Clinic who just joined our editorial board, discuss possible pathophysiological mechanisms that might be responsible for associations between insomnia and sleep-related breathing disorders. You will find their insights fascinating and important for future discussions with your insomnia patients. As always, online access to these Editor's Choice and Highlights articles is free during the month of December of 2014. And for more information, please visit our Mayo Clinic Proceedings website. And I'll see you again next year.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.